Sponsored by Assy Dental Associates.
Well, thank you for staying with us. Hour 2, your health report is a little different this afternoon. Very excited to have a guest with us. You know, we are just a week away from the start of fall, but we are already thinking about seasonal respiratory viruses such as flu and COVID. The Food and Drug Administration has approved new COVID vaccines, but both are made to target viruses that are currently circulating. Joining us right now via Zoom is health reporter Joseph Choi with The Hill. Joseph, thank you so much for being with us this afternoon.
Glad to be here.
We'd like you to give us a little more insight in terms of what's going around right now and what people need to do to stay healthy. So the first big question is, who should get this new vaccine?
Right. So the CDC signed off on the updated vaccines from Moderna and Pfizer earlier this week. And they are some pharmacies, some locations may be offering those vaccines already by the end of this week. People should call ahead and see if there's supply. These vaccines will be targeting the XBB Omicron subvariant. And right now, the EG.5 subvariant, which is a descendant of that, is the most prevalent strain in the US, accounting for about 1 out of 4 COVID-19 cases, according to what available data we're getting from the CDC. And so we're getting a really close match to the strain and to the vaccine, which is always a good sign.
I think that most people, I was just going to say, Joseph, most people listening and watching probably agree. They probably know someone who has tested positive for COVID or showing some symptoms right now and concerned about whether they are fully vaccinated or up to date on vaccines. Can you clarify what it means? Is there a difference between being fully vaccinated and up to date on vaccines?
You know, the CDC in its announcement didn't make a specific statement on eligibility, on who is considered fully vaccinated, who isn't. In prior recommendations, they have said that before getting a booster, you should get the 2 initial doses that I think many of us remember getting in late 2020, early 2021. This time around, they didn't specify whether or not you need to get those first 2 doses before getting this booster dose, which is closer match. Those older doses, I believe, aren't even approved anymore because they're outdated and not matching the current circulating strains. At this point, we're more than 3 years living with COVID. Most people have antibodies either from prior infections or previous vaccinations. So this should be considered something of a booster for most people.
So with this booster, wondering how long does the protection last? And also, if you had a different kind of Moderna, can you mix that with, let's say, a Johnson & Johnson? Can you mix and match?
As far as longevity, we have seen in previous vaccines, whether it's flu or COVID, it lasts about a few months, 2 or 3, maybe up to 6. There's different data coming from different places. What we do know is that strong, robust protection that's going to help you avoid an infection lasts for a few months. Long term, it should help you avoid getting a severe case. As far as if you can mix and match, the FDA has said previously that you can. They have okayed mixing vaccines in the past, as long as they're both mRNA vaccines, which the ones that are approved this week were.
All right, Joseph Choi at The Hill, thank you so much for the conversation, information, and time. We appreciate it. And of course, we have all of this information posted on our website, counton2.com.